Hello, everybody. It is a great pleasure to introduce Kimberly Christnacht. In a few years, she will be Dr. Kimberly Christnacht because she's just, she's crossing her fingers. I, I don't think it's going to be a matter of luck. I think she's like going to do it because she's so smart. She's just finishing her first year of medical school at University of Colorado School of Medicine. And these days, medical students have to complete a research project that spans their 4 years of medical school. So Kimmy came and talked to me and asked if she could work with me to do that. You know what? I lost the little cheat sheet about you. No, I didn't. Thank you. Kimmy is from Denver. She has a BA in theater and a BS in biology from Millikan University in Decatur, Illinois. And as I mentioned, she just is finishing her first year of med school. She has a particular interest in serving pediatric special needs population, and she likes neurology and psychiatry. Kimmy has a sister with Down syndrome, which is, I think, one thing that got her into this field. And before medical school, she provided respite for children with developmental disabilities. And that has sparked her interest in pediatrics and patients with rare disorders. So Kimmy's been working really, really hard on looking at data from my antioxidant study and pulled together a pretty poster, which is up there with the mountains on top because we come from Colorado. And I'd like to pass the mic to her so she can explain a little bit about the project she's been working on.
Well, thank you. And I just wanted to thank Gretchen and Dr. Elias for allowing me to come here and learn from you all. It's been a wonderful experience so far. All right. So I feel like you've heard a lot about the physiology of SLOS at this point. But as we know, it's a syndrome that's an autosomal recessive disease caused by a defect in cholesterol metabolism, which leads to the buildup of different byproducts or different precursors to cholesterol. And when these precursors build up, this can lead to different issues, including progressive retinal degeneration. So SLOS can be classified as mild, moderate, or severe based on both the genotype and the clinical symptoms of patients. And we find that phototransduction, or the ability for rods and cones in the eye to work, is abnormal in SLOS, likely due to high levels of these precursors like 7-DHC. When these precursors are oxidized, this leads to oxysterols that can build up and be potentially harmful. So hard to see, but this first figure is of a study in rats, with this left figure showing normal rat retinas and this right figure showing a rat retina after it's been exposed to some of those oxysterols, which we can just see the organization is kind of scrambled up. And that is our hypothesis for what leads to the retinal degeneration. So the purpose of our study was to determine the effect of treatment with antioxidants and how this affected retinal degeneration over time. So we had 9 different patients that we studied for this particular part of our research. Data was from 2008 to about present, and these patients were treated with antioxidants such as Aquadex, and we eventually moved to Decus Plus when Aquadex was discontinued. You can probably see easier on the poster, but there is a breakdown of the different nutritional information in these figures. And so we did a baseline electroretinogram studying the eyes of these patients when they are diagnosed, and we repeated them no more frequently than every year moving forward. In terms of our results, we classified our patients in different cohorts based on mild, moderate, or severe based on those different levels of 7-DHC. And on the left, these two figures are looking at the amplitude or rod function and response during those tests. And the right figures are showing the implicit time, or how long it takes for rods to respond to stimulation. So it's important to note that these dotted pink lines are the normal, what we're looking for. So anything above the pink line on these left figures would be considered normal, acceptable ranges, and everything below the pink line on the right would be considered normal implicit times. And overall, we found that there were decreased amplitudes, but rods improved towards normal values in our mild and moderate patients. And there was increased implicit time for 2 of the 3 patients in our mild cohort, but they remained mildly abnormal, but we did see improvements overall. For moderate patients, the decreased amplitudes improved from moderate to mild towards normal values in 3 of the 4 patients, and implicit times remained within a normal range of 3 of the 4 patients as well. We also combined our severe data in this purple line with the moderate patients, For our 1 severe patient, there were mild to moderate decreased amplitudes and rods, which improved over time. You can see as that purple line is increasing, and implicit times remained within a normal range as well. So overall, our study allows us to objectively follow retinal function in patients with known degeneration of the retina. And over time, as patients continue to take antioxidants, there is an improvement or stabilization of rod function. We need future research to determine which specific antioxidants might be the most influential in all this. When I'm saying antioxidants, I'm meaning vitamins, so like vitamin D, vitamin E. We need future studies to determine which of those antioxidants is the most influential, but we hypothesize that vitamin E might be a huge player in the game. So future studies will also analyze oxysterol levels to see if the antioxidants are indeed leading to the decrease of those oxysterols, which improves retina function as we hypothesize. Overall, treatment of SLOS with cholesterol and antioxidants is associated with improvement of retinal function as determined by these ERGs, and future studies of antioxidants and retina function may someday help other diseases that result in retinal degeneration. All of this information is available on my poster, and I'm happy to take any quick questions now or answer questions later if you come up with any. Thank you. Great, well, there's no questions now. That's okay. I will be here for the next couple hours before I have to go catch my flight, but thank you all for coming and for listening.